Hey, everybody. Thanks for tuning in to another episode of the Strength and Knowledge podcast. I was just chatting with our newest guest on this particular episode, just about everything COVID, being in leadership positions where we are continually having to monitor, manage, really feeling like, at least how I've put it, I feel like a pinball machine because I'm rolling, I'm doing well. I get whacked by that little thing back up to the top. I'm hoping I don't fall into the side where it's game over. But it's really just been a whirlwind of a year. But I'm very, very, very happy to introduce my next guest, and I will give him an opportunity. Really just introduce yourself and tell us a little bit about how you've gotten to the position that you're into today.
Well, I appreciate that. I definitely think pinball machine is one way to put it for sure. Yeah. I mean, talk about a year. But yes, my name is Rodney Caffey. I'm an athletic trainer down here in Mansfield, Texas, which is just south of Dallas. I work for a company called Arlington Orthopedic Associates, the Performance Institute, and we partner with Wise Hospital here. And so really how I got into this profession in general is I was an athlete all my life. And went to college to play football in college and was a college athlete and then got hurt. I feel like that's a traditional story, right? Everyone gets hurt and they're like, okay, what's next? And so I kind of took the route of going the college strength conditioning route. I was like, okay, I love working out. I love being around sports. What better way to do that and influence people than be a college strength coach? So I remember I had shoulder surgery. I'm in my sling like this, slap surgery. And I'm out there trying to coach with one arm and showing people how to do a kettlebell snatch with one arm. Probably not the best idea, but so that's kind of how I got into it. But then I quickly realized one day we had one of our athletes go down with it was actually a hamstring tear. He was doing sprints and tore his hamstring. And I stopped everything I did and went right to him and just really felt a calling to help him. Like, most coaches are like, wipe it off, wipe the dirt up, get up, just go. And I wanted to know what's going on. I never encountered that before. I never had to help someone in that situation. I felt that calling to try to understand really how can I help this athlete when they're in their deepest, darkest time, when they're hurt. Not so much of getting big and strong, but trying to figure out ways to get them back to where they need to be. And so I was talking to my advisor one day and I said, look, I've kind of had this change of heart. I've been through injuries myself and I had this encounter. I told him that story and he goes, well, it sounds like you would be better fit for the medical field because you have that heart for people. And I said, well, but what is there to do in the medical field that fits what I like? He goes, well, have you ever thought about sports medicine? I'm like, what, like a doctor? He goes, well, there's other avenues for that, like physical therapy, athletic training. And he said that and I was like, what is athletic training? He goes, well, those guys that go out in the field when you get hurt, when you got hurt and they took care of you? I said, oh, you mean like the trainers? He goes, yeah, those are called athletic trainers. I said, oh, okay. I had no idea, right? You just don't know. You don't think about those things. And he goes, you really need to go talk to some of them, just see what they do. And so I went to the training room the next day and just hung out with them for the day and saw them doing rehab, saw them really being the frontline care for those athletes. And I was like, wow, this is exactly what I want to do. This is everything that I envisioned. I love the emergency care standpoint. I love the rehab. I love the collaboration between other healthcare providers. And so from then I finished up my degree, got my master's degree at UTA over here in Arlington, Texas, and got my first job at Children's Health Andrews Institute. So Dr. James Andrews, worked for one of his hospitals in Plano, Texas, and then got hired on here to open up this facility and start from the ground up. So pretty neat.
That's awesome, man. I mean, yeah.
Thanks.
No, we'll dive into your background here in a second here. I mean, I think it's unique and that a lot of people don't have the strength and conditioning and fitness background who are in the rehab world. But just so that everybody has a full understanding, Abilene Christian, right? In Texas. Okay.
Correct.
You grew up playing high school Texas football.
Oh, of course.
Right. Yep. Mm-hmm. The stadium that is around the corner from your office is a high school stadium that seats how many?
Oh, this one I think seats over 15,000. I think they're building a new one like seats 20,000 people.
Okay, so definitely a huge deal. When I think of Friday Night Lights,
for sure,
about your life. Okay, So
Yep.
definitely just painting a picture for the audience here. But for you, I mean, I think, the thing that's so beneficial, and I think not only were you an athlete and you got to experience like fitness wellness, but you were an athlete, you got to experience rehab. And then in addition to that, you went and learned about how to prepare people for sport, the fitness and wellness side of things. So that background, I think, automatically puts somebody like you where you've experienced things and then you're able to communicate what is actually going on. I can remember going through a period of my life where, just because I had experienced it did not mean that I was qualified to coach it or to work with somebody. And I view kind of our role now as being a coach. So if I equate that to sports, just because I played a certain sport does not put me in a position where I can then coach that sport. And too often I was going through school and I was seeing people that they thought because they went to the gym that they had an understanding of that sports performance or that strength and conditioning side of the house. So what are some things that you think that you saw that really made probably the early years of your career easier that other people struggled with?
I think the things that I saw that really benefited me in the early years of my career was just having the programming standpoint, and understanding the progressions, because I remember in grad school, we're learning about rehab progressions. We're learning about ACL progressions and, taking them from start to finish and what we're supposed to do. And in my mind, that clicked easy because I had already seen it in the strength conditioning world. I already seen it, how we start in the off season and then we move to that preseason, and then we move to in season. And so I thought that was probably the easiest thing to grasp. And then just relatable standpoint of being a college athlete, being injured, being able to relate to those athletes that are injured and explaining, hey, look, I've been where you're at. I know what you're going through. Yes, I know it sucks. I get it. But there is light at the end of the tunnel. You can get through this if you work hard, and I'll show you how to do it. I'm going to walk right with it through you, walk through it with you.
Yeah. And I think
those are big things for me.
No. Yeah. It leads me to like the kind of the next question and really the unique side of the state of Texas and scope of practice. The last course that we hosted was in Boston. We didn't have any athletic trainers because I think that state, much like where we're at in Maryland, they're not doing as much of the rehabilitation in the facility. Their roles and the privileges that they have due to a wide variety of different reasons are solely dedicated to either the athletic training room or on-field coverage.
Right.
Expand a little bit on your role, what you're allowed to do in the state of Texas, and a little bit more about how that allows you to really be like a Swiss Army knife.
Yeah, for sure. Yeah, I love that standpoint. Like you said, Swiss Army knife, because, we're a jack of all trades, and I get to utilize that in my clinic. And so for us, I work hand in hand with our physical therapist every single day, whether that is taking over that patient from physical therapy. Say the patient has met their outcomes, right? They've gotten full range of motion. They're able to do the return to sport test, whatever it might be. I can then take that patient over and basically have full autonomy over that patient in my setting here. So I can take them from that, start with me at the end of the PT, and then take them back to their sport. So I fill in that gap here. We call it the bridge program. A lot of people use that terminology, but I fill in that gap here, and I'm able to utilize any skill set that I want. I'm not limited by insurance because we do a cash-based system here. So it's a little unique in that standpoint. So I'm not limited by insurance, but I'm able to view their protocols and follow the protocols that the physician lays out. I'm able to utilize that, but also with insurance, we're limited to one extremity. Well, I can incorporate the other extremity, or I can incorporate some upper body work if it's a lower extremity injury. I'm not limited in that scope, which I love that. And then on top of that, I can have a direct referral source here. So say an athlete calls me from one of the area high schools and says, or the coach calls me even, says, hey, I've had an athlete get injured. We didn't have an AT on site. Can you look at them real quick and just get them into the clinic? And I can say, sure, yeah. So I'll evaluate them here, just like direct access. And then from there, I'll determine which physician to send them to. So we have a large practice of almost 30 orthopedic sports medicine physicians with different specialties in that. And so I can say, hey, this is a lower extremity injury. I think it's an ACL. I always say differential diagnosis, just to be clear on that. I always say differential diagnosis. This is what I'm seeing. I think it's a grade 2 or grade 3 ACL. I'll then call the physician, set up the appointment for them, expedite that process, get them in either that day or the next day. And so it's that full circle of care. And then the physician can then refer back to either me or the PT for the continuation of their care, either post-surgery, post-evaluation, whatever we need to do. So I'm not limited in any regards when it comes to orthopedic sports medicine. And I can also go in the clinic here with our physicians if they need me to.
That's awesome. I mean, you have a lot less barriers than we do. I mean, we can't bill for somebody with an ATC in our office. They have to serve as a tech or an aide. They need physician privileges. They have to sign off on a document that a physician is pretty much holding their ability to do what they do in our state. So it puts them in a position where people are using them as physician extenders often, where they're serving support roles in an office setting. But very few times, except for some of the big like PE places, are they serving a designated role within a clinic, because honestly, they're just not billable, Right. So, we could get into all of the different, probably bureaucratic challenges associated with why that is the way that it is.
That's a rabbit trail.
What's that?
That's a rabbit trail to go down.
Yeah. And we could probably say some choice words about the whole process in itself too. But you're obviously fortunate that you're in the state that you're in. And it sounds like, and at least based on what I've seen, that you're in a great company. There's definitely no shortage of facilities and fun toys to play with. Your guys' facility reminds me a little bit of ours, just with regards to the versatility of the environment and the equipment that you're provided. But getting back to something that you brought up, and I know it's something that you've mentioned in a previous conversation, but being able to treat people regionally, the phrase regional interdependence sometimes popped up when I was hearing you talk about it, but recognizing that a knee issue is so much more than a knee issue, not just a left knee issue, but beyond just even that side of the body. So talk to me a little bit about maybe a moment in which you were exposed to something that made you think beyond a local area, and then some things that you think are critical, especially in your role, as you're taking on students yourself in that teaching point of view.
For sure. So as you mentioned, I take on students. I'm a clinical preceptor for one of the local universities here. And so I take on AT students and also some PT students as well, just to take them through the process of sports medicine. And so one thing that I really see is I'll have patients come in and say it's a 17-year-old male runner, right? And he's saying, I'm having knee issues, but it's right here. And he's pointing right to the front, that patellofemoral pain that we always see with our runners, right? And so I'll usually have one of my students evaluate that patient. And then they're saying, okay, well, I'm seeing that there's quad weakness. Okay, well, are you just looking at the quad? What else do you need to be looking at? And they're kind of stunned because they don't think about, or they haven't either been taught that or don't think about it looking from a global standpoint. And I always remind them the body's connected. It's a kinetic chain. And so just because the issue might be at the knee itself, you need to look above and below that area. So I say, well, how's his ankle mobility? Can he get into dorsiflexion appropriately? What's his range of motion there? Is he able to, or is this patient able to activate their glute complex appropriately? Is he able to follow through extension with the stance phase when he's running? Things like that. Like, are you looking from a global standpoint? If you hone in on just one area, you're going to miss the whole big picture. You can't just localize your viewpoints and your treatments, because you're going to really miss a critical point to treat a patient.
Yeah, I mean, I couldn't agree more. And I think even when you look at, if we look at competencies that one side of the body might not have as a result of surgery, and obviously a diminished capacity as well, it's something where I even have a conversation with our students or even our team. But how can I make sure that I build the unaffected side as much as possible, knowing that if I keep taking that ceiling high up on the other side, I'm going to continually have another side that wants to catch up to it. So if we go beyond even just looking at other joints, and we just make sure that we're building, this unaffected side in a manner and training it. And then we get to the psychological profile, right? And all of the different things that go in to that athlete actually feeling ready for competition. I think about the, say ACS or ACL return to sport index, right? All of the different psychological factors. And there's just something to be said for treating somebody like an athlete, training them for sport and training them for life in a manner that goes so far beyond just the knee injury, right? I might have had a knee injury, but I might have them doing a single leg push-up to emphasize, isometric quadricep, right? Time under tension while doing an upper body task, right? Or I might be doing something in a split stance position at some point with, say, a cable chop and lift to get that same isometric time under tension in a 90-degree position at the knee. Like, there's just so many other ways to be thinking about how to train and treat that knee while incorporating the whole athlete. So, I mean, I love that. It's something I got exposed, whether or not it was Gray Cook or Mike Boyle or one of these other people that has talked about, that regional interdependence concept. It's definitely something that resonated with me. And it's something that's just been such a mainstay for me. And I think, kind of heading into a topic that we also discussed, but on injury prevention, I think when you treat the whole body and you go beyond just that narrow window of focus, that you also might catch certain things, or at least better prepare that athlete, especially during a time period where they could end up detrained. So tell the audience a little bit about really the injury prevention focus that you're able to have, kind of why prevention isn't a good catch-all word. And I'll let you take it from here.
Okay. Appreciate that. I love that you mentioned, talking about doing, half kneeling chops and lifts or things like that, because I always get the question from a patient, why am I doing this? It's my knee. Or why am I doing a push-up, like you said, with a single leg push-up? It's my knee. And then explaining, well, isn't your whole body connected? Aren't you an athlete? Don't you use your whole body, not just one aspect of your body? And so to tail that into your injury prevention standpoint, I don't like that it's a catch-all, right? Because you can't truly prevent every single injury. We talk about non-contact injuries and we talk about contact injuries, especially in female soccer athletes. That's the pandemic or epidemic, whatever word you want to use, going on with that right now. And
no more pandemic, please.
I'm sorry, epidemic. Sorry. Yeah, no more pandemic. And just discussing that because I have patients come in all the time and parents come in all the time. What can we do to make sure that my son or daughter stays healthy and they're not injured this year? And my answer to that is always, you can't. I mean, there's no way I could write the very best injury prevention program. We can do FIFA 25 plus, whatever, there's no way to truly prevent an injury. And their view on that is, well, why not? And I said, well, can't you just walk off that curb right now outside and twist your ankle? It's not just about the sport. It's about things just happen. And so while that's a catch-all term, there are things you can do to mitigate that and ensure that you're decreasing those chances, right? And you're not, and I love what you mentioned on working both sides of the body, incorporating core work, right? The big core word. Okay, well, what are we doing for core stability? What are some things to do for that? If I have an ACL patient, or even a shoulder patient, I'm still going to do core stability work. Doesn't matter what extremity it is, because that ties directly in the center of the body. Why not incorporate that in some regard? I can still have them do, if it's a shoulder patient, I can have them doing ball on the wall stuff and a bridge with it, or a single leg, knee raise on a Swiss ball. I'm still getting the core in, they're getting posture in, but they're still also working their shoulder. So there are, like you said, so many different ways to incorporate that. But if you're not incorporating those key pieces and tying all of that together, whether it's the core, whether it's, bilateral work, then you're going to miss a key standpoint of your training programs and really, truly preventing or decreasing those injuries.
Sounds like a little bit of Exos influence when I'm thinking of the word pillar. Does that sound familiar?
Yes, it does sound familiar. I did work with Exos. I did learn a ton from Exos because of my background with them. And so, yes, you are very correct on that. And they have a great system, and I learned a lot from them. But great cook. I mean, I'm telling you, I learned a lot from him as well, and love his standpoint on that as well.
I'm thinking about the book Movement, and I'm thinking about Core Performance by both of the authors that you just mentioned.
Yep.
And I'll be fully transparent. I've told some people this. Rehab to Perform was athletes' performance inspired, and that I didn't see a fitness focused like commercial model to physical therapy. I saw a fitness focused environment that I was used to at Ohio State that was reserved for elite athletes, but it was not reserved for like the active adult, like the high school athletes. So I had a lot of ties, at least educationally, to like going to athletes' performance before it was Exos, right? Yeah. Going to FMS stuff, going to SFMA, having this movement focused, I'd say, approach that just kind of allowed me to branch off there in a wide variety of different directions. But I mean, for you've collaborated with a lot of, different places. I mean, I hear Exos, I hear Kevin Wilk, I hear like D1 sports training, obviously some universities around you. You're in a highly populated area for college student athletes. What are some things that you think have always maybe been natural for you, or some things that you focused on when it comes to career development and then collaborating, as I imagine you do, especially with the college athletes that you see?
For sure. I think what's come naturally for me is just being a spokesman for our fields. I love seeing PTs, ATs, strength conditioning professionals just work hand in hand. And that was the Exos environment, right? The athlete's performance. You see that because of that, those skill sets all come together. And being able to say, look, I know physical therapists that can do this for you. They're great at what they do. I know a strength conditioning coach that can do this. They're great at what they do. And not ever coming off as, well, my profession is better than this profession, or I'm better at this than this. It's, I learn from across the board and collaborate across the board. And I'm going to make sure that whatever patient or even a client gets the best treatment that they deserve. It's not about me. It's about what's going to be best for the individual and what's going to be best for all of our professions working together. And so that's what's come natural for me. I'm a public relations chairman for SWATA, which is Texas and Arkansas Athletic Trainers Association. We call it Southwest Athletic Trainers Association. And that's a big standpoint for me, is being able to find ways to work hand in hand with other healthcare providers. And that's what I've been pushing every day since I've gotten on board with that. And then to your other question, some things that I've seen, working with some college athletes and even some professional athletes, because I worked with the XFL this past year. I don't know if I mentioned that. Yeah.
No.
Yeah. Forgot to mention that.
There's always surprises on here, man.
So loved it. That would talk about an awesome experience. Just kind of building from the ground up on that. And just seeing how some of these athletes, even at these top tier institutions, top level environments, never really fully understood what they needed to do to take care of themselves, what they needed to do post-injury, how they should be taken care of. I had guys come in, even from the XFL, that says, wow, you've shown me things that no one's ever told me before. You've taken better care of me than I've ever imagined. That's such a compliment to not just me, but our profession as providers, how it should be, right? But then my question is, where were we missing the mark? What happened in the past? And we're changing that. Like people like you and I and other providers that are continually moving forward and trying to better themselves, we're making such a mark for these athletes and a mark for our profession that we're going to change the game, and we're going to change the environment on that. And so that's what gets me fired up. I don't know if that's where you wanted to go with that topic, but I get fired up for that.
Yeah, I mean, I look at that and it's decreasing silos. And I think when you talk about like decreasing silos, it's sometimes we've siloed ourselves in terms of just being the rehabilitation professional. And we ignore conversations about basic public health or recovery strategies that are like low-hanging fruit, like sleep hygiene, or just talking about what balanced nutrition looks like, single ingredient foods, water, very, very widely accepted supplementation, not fringe supplementation recommendations, but these opportunities where I think the part that I was pulled into the profession with was the amount of time that I got to spend with my PT when I was injured. Like the relationship was so much different because I thought I might have wanted to be like a PA or an orthopedic surgeon. Okay, I'm either doing surgery on somebody that doesn't get to talk to me, which, don't get me wrong, it's valuable. And obviously it compensates way better than
for sure.
But the relationship side was just such a huge piece for me. So you have this person, and let's say it's just an average like 9 visits or whatever, and they come in and you're developing rapport and you're just layering in these little behavioral things that can go so far beyond what they're doing with regards to just the injury that they're coming in for. We're doing even things like email newsletter, right? It goes out timed with their first visit. After this many days, they get a sleep email. After this many days, they get a nutrition email. After this many days, they get one on mindset. Like, so these things that are just kind of layered in. We have an app that we're coming out with that's going to have some of that stuff just repurposed, appreciating that sometimes people need a different platform and a different medium to engage with these things. But I love it because when I think about what also drew me to, that environment at Ohio State, it was, okay, the strength coach, the PT, the athletic trainer, the team physician, and my coach are all in the room talking about me. Wow. I really feel like I'm taken care of, right? And I'm positive that I'm going to get right and I'm going to be able to go play. So that more integrated continuum of care. Not all of us are in an environment where we are able to have some of the talks that you might be able to have on a regular basis. Sure. So being able to blend, and I don't want to say take over some of the areas that other people are doing, but you might have to overlap a little bit more and at least speak to some of the things that you're assuming are going to be talked about in that area, knowing that you do have somebody that's a little bit more of a specialist there, but at least generally appreciating these different silos that sometimes people put themselves in. So yeah, I mean, I can absolutely appreciate it. I don't even know how you do it, just being, you're an orthopedic tech, you have an orthopedic tech certification, you have the ability to be in surgeries. Like, I don't know what you don't do. Do you come in and do like the cleaning on the weekends too? Or like what? Like
only occasionally if they need me.
Okay. Got it.
This weekend I will when y'all are here.
Oh yeah, no, for sure. And I mean, let's be honest, it's COVID and the amount of time, like I might actually have like trigger finger from shooting a squirt bottle,
Oh my gosh. Speak of the devil.
Yeah. It's crazy. The only thing that I want to, like before we wrap here, like, are you going to be able to meet The Rock? Have you met The Rock already with the XFL?
No, not yet.
Oh,
I'm like, dude, when are you going to come see me? I know he wants to. I know he's just putting it off and he's probably shy. But I'm like, all right, man, I'm ready when you are. I know I'm busy. I do all these things, but I will make time for you.
The real question is, can you sneak a wrestling move off on him while he's not looking? Okay,
Lord,
that's
no.
what I want.
That's where I die.
Yeah. So yeah, I mean, you shared a little bit of it. We're very happy to bring our Blueprints course to Texas this weekend. Obviously, a lot of rules and things that we're needing to follow, but you know what? It is just the way that things need to be done in 2020. We ran a very, very safe course in Boston, being asked to do some of the very, very same things with professionals. I think we could all agree that there's a certain standard that everybody holds themselves to that really allows things like that to be completed in a less stressful manner. But Rodney, really, I mean, just to close, where can people interact with you? Where can they stay in touch with not only yourself, but also AOA and, the rest of your organization?
For sure. We have our own website, AOA Performance Institute. You can always go on there. If you ever need anything, you can reach out. We have a newsletter that we do send out occasionally. We are working on, writing blogs and things like that. So that's kind of a new development for us. And then for our physician group, it's Arlington Orthopedic Associates. We're in the DFW area. We're now the largest orthopedic group in DFW. And so, getting to hold that designation is a very big deal for us. And we love that. But we also want to make sure that we still are personal with our patients and we still care about them. And we don't let that go by the wayside, that we hold ourselves to a high standard. And then you can always reach me. If you ever need anything, any students or PTs, ATs, whatever it might be, you can always reach me at my email, which is rcaffey, Caffey, at arlingtonortho.com. If you have any questions, always feel free to reach out. I'm super busy, but you know what? I love teaching. I love moving our professions forward and collaborating. So I'd be glad to do whatever I can to help anyone out.
Yeah, super busy is an understatement. I don't even know what is your job description has to be like 7 pages, but nonetheless, hey man, I really appreciate you making time for me. I know you're super busy. We're super pumped to bring the course. And as I mentioned, I'm not going to be able to, unfortunately, see you this weekend, but we'll be back in the future.
For sure, dude. Thanks so much, man.
Absolutely, man. Have a great week.
You too.